this is Pam Dunwald from Your Nurse Advocate Consulting and also with the Patient Advocacy Incubator. And we are here, we're getting ready for prepping for the next round of board certification for patient advocacy that's coming up in March. And so just really nice to have Lindsay Raisin here and Darcy Walker. Both of them were in our first workshop, and then they both sat and successfully completed the board certification exam. So really excited to have them. And I just wanted to take a minute and just kind of ask them about how the workshop helped and if they have any tips for anybody that's thinking about taking the exam. So Lindsay, what did you think about the workshop?
Well, to be very honest with you, I was extremely grateful to hear when Pam and her partner had announced that they were doing a workshop, because as much as I kind of thought that I had an idea of what patient advocacy was, and you kind of research it, and their course prepares you and it helps you think about the role as a patient advocate and some of the ethical and professional situations that come up that you wouldn't even think of. And, or, I mean, really highlighting, we're all nurses, and, a patient advocate actually is a very different role. And so you're working for the patient, you're not working for a hospital, and there's fine lines and there are boundaries and things that in fact, I took the prep course and I'm like, oh boy, this is a lot of stuff that I never even thought of. And so my advice to you is don't let that intimidate you, because Pam and they do a wonderful job at the prep course, but that's just a tidbit of it, truthfully. And the good thing is that this patient advocate role is in the infant stages, and so it's developing and it's going to morph. But I am very thankful because I learned a lot of things, again, from like an ethical, like the code of ethics and things that you shouldn't do, and can't not being suggestive or recommending things, that's really hard, and that's just a different role to play. So I was super, super appreciative of that, because I thought I knew, but I didn't.
Yep, that's too. Darcy, anything you want to add to that?
I just enjoyed the studying and going to the class to take the test, because it helped me kind of learn about a different side of healthcare that I hadn't really taken the time to read about. I read one of the books that was just explaining all the different parts of healthcare that it had talked about and recommended and for studying, and it was really informative. As my role that I'm in case management, I hadn't really taken the time to learn about that, and I think the webinar and stuff really helped it all come together too. So
thanks. And you two ladies would like to say we are, again, we're getting ready to launch our workshop. So any final thoughts?
There was a practice test, correct?
Yes, we did practice tests. We did.
That really helped.
Yes. And we did the practice questions. Mm-hmm.
So
yeah, I think all
worth it.
Yeah, I think all the info, that's what I used to study for the test, and I thought it was really helpful.
Awesome. Well, I want to thank you both, and again, congratulations on passing that exam and launching your career as patient advocates. And we'll see everyone at a webinar soon.
Awesome. Thank you.
Thanks.